Everyone, thanks for joining us for Inside Grand Rounds video lecture series. My name is Siraj, and I will be filling in today for Evan. So today we're going to have Dr. Neeraj Bhole present on dry needling. Dr. Neeraj graduated with a bachelor's degree in physiotherapy from the PT School and Center Government Medical College in Nagpur, India. In 2006, Dr. Bhole's clinical rotation experience included a variety of different sectors, including outpatient clinic, multi-specialty hospital in different settings such as neuromedicine, pediatrics, orthopedics, ICU, and general surgery. Dr. Neeraj received his master's degree in exercise science and kinesiology from Oakland University, Michigan in 2011. He then graduated as a doctor of physical therapy from Utica College, New York in 2015. He most recently has received a certification in orthopedic manual physical therapy in April 2022 and will be continuing through a residency program starting in the summer of 2022. So that should be updated. Dr. Neeraj has more than 13 years of experience as a physical therapist and has become a registered physical therapist in the state of Michigan in September 2008. He has 8 years of experience in home health care, 5 years of experience in skilled nursing facilities, and 1 year of outpatient experience. Dr. Neeraj has helped numerous people rehabilitate after complex orthopedic and cardiopulmonary, neurological, and spine surgeries. Dr. Neeraj strives to help his patients to find and achieve their goal towards rehabilitation. His consultations often include conversations regarding healthy life choices. He believes this further promotes healing. Moreover, Dr. Neeraj shows electric interest in pain management using physical therapy modalities. Dr. Neeraj's hobbies include photography, cooking, listening to audiobooks, and traveling. Dr. Bhole, are you there?
Yes.
Okay. So I'm going to let you get started on your presentation, and it'll be followed by a quick question and answer session.
Sure. Thank you, Siraj, for your introduction. And but again, somebody who is joining late, my name is Neeraj Bhole. I'm a physical therapist here at outpatient at Inside Comprehensive Therapy. So the topic of my today's presentation is dry needling. What is dry needling? Dry needling is used to treat musculoskeletal disorders for pain, and which is done by insertion of a needle in muscular myofascial trigger points and other connective tissue. It is called dry needling because no medication is used. A clinician tries to elicit a concordant sign or Dirk response. So what is a concordant sign? Concordant sign is a discomfort or a noxious stimulus or painful stimulus, which is similar what a patient is experiencing. Now, this Dirk response comes from acupuncture, which I'll briefly talk in my next slide. Sometimes you can try to elicit the twitch response. And some of the early pioneers are Trovell and Simons and Dr. Gunn in the field of dry needling. There are different school of thoughts on dry needling. Some definitely just go for trigger points. They go for twitch response, and at the same time, they, like Dr. Gunn, uses a methodology just like having the needle in the muscle or at the target place. So what is the difference between dry needling and acupuncture? Acupuncture is based on ancient Chinese practice. It's been around for more than 3,000 years and still being practiced in China and worldwide. Dry needling is based on reasoning of Western medicine. Some of the literature I also found also called as Western acupuncture. Acupuncture focuses on effective flow of energy, which is known as qi. And there are different, in acupuncture philosophy, it is believed there are different meridians and through which the energy flows. And whenever there is a blockage, it can create different problems. So an acupuncturist would take a needle and hit on certain spots, which are the acupuncture points, and will try to open up those blockages. So that's what pretty much very brief about acupuncture. Again, it's a very vast topic, so I'll just keep it very concise on this. Moving on to what are the different types of dry needling techniques. One is fanning, where you take the needle, for instance, in a muscle belly, and you are pretty much going back and forth like you're sewing, but the needle is not coming out of the target tissue. It just pretty much stays in the target. And then next is twisting. Twisting is where the needle is at the target spot, and then you either wind it clockwise or counterclockwise. Then there is periosteal pecking, where you take the needle all the way to the periosteum of the bone. These are only for like very certain spots. For example, in tennis elbow or lateral epicondylitis or epicondylgia, these days they call it as, where you take the needle all the way to the lateral epicondyle at the common extensor origin, and you just do like few taps for like 10 to 15 seconds. And next one is superficial dry needling, which are used for myofascial trigger points. Deep dry needling, and then this is a very important component, the electrical stimulation. So imagine some of you or most of you have heard of TENS unit. So you take those electrodes and have them hook them up to the needles, and then you stimulate them from like say 5 minutes to, depending on the region you're treating and what the patient can tolerate. But again, there are like, you have to follow, of course, the indications, and some patients who have a pacemaker or defibrillator may not be a candidate for electrical stimulation. So here is a brief clip we made, and I will share this with you. And so in this clip, I'll be doing a fanning technique. And if you watch closely, just a few seconds, there goes the needle. It's in the upper trap, left upper trap. And that's I'm doing fanning, which is like the back and forth of the muscle. And I'm not taking the needle out of the muscle belly. Now, if you see closely, you will see a twitch response. Just in view, there will be like 2 to 3 twitch responses. Yep, there was a twitch response. Okay, so going back to my presentation. All right, so the dry needling needles are pretty much the same as acupuncture needles. Most commonly used are stainless steel needles. The tip of the needle is very blunt, but tiny. With the insertion of needle, it's painless to minimal pain. Common sizes are from 26 to 40 gauge and lengths from 0.5 to 2.5 inches. Just want to share another clip just to give you a fair idea, like what our dry needling needles are. So go here and bear with me. All right. So that was just like a quick clip of like what needles we use for dry needling. And hold on, let me get this to the full screen. Yep, and as you see, those are individually wrapped needles, and they come with a guide tube, and pretty much only single use. So let's move on to the next. So what are the benefits of dry needling? Dry needling is beneficial for neck pain, low back pain, for migraine, tension type headaches, disc problems, shoulder pain, tennis or golfer's elbow, osteoarthritis of knee, tendinopathy, plantar fasciitis, TM joint disorder, carpal tunnel syndrome. So how does the dry needling works, and how does it decreases pain? There are different mechanisms out there. One mechanism is by activation of opioid-based pain reduction from sympathetic nervous system. Other is activation of non-opioid-based pain reduction via serotonin and norepinephrine from the brainstem. Then there is reduction of inflammatory causing chemicals such as cytokines. There's stimulation of immune cells, fibroblasts, and keratinocytes, release of histamine. Now, how does like the dry needling works for tendinopathy? With dry needling, there is enhanced tendon healing by improving blood flow via local vasodilation, increase in blood saturation levels in the tendon, and increase in fibroblastic growth factor, which is very important for the repair. Now, the frequency of dry needling usually is at least twice a week for 2 weeks, then once a week for 2 weeks. But sometimes due to scheduling or patient cannot come, so it can be 1 to 2 times. And then after 4 weeks, it can be extended based on medical necessity. Now, the duration of dry needling can be anywhere from 5 minutes to 60 minutes, different location. This is through one of the study I came across, like for example, for low back pain, 10 minutes to 30 minutes. I'm not going to go through all, but on an average, at least just to have a good effect, it's like 15 minutes. But again, it also has to depend what patient can tolerate, what the person can tolerate. That what is more important. Then coverage, most important question, is dry needling covered by insurance? And unfortunately, it is not a covered benefit from most of the health insurances. It is an out-of-pocket expense. Right now, we're charging about $35 to $45 per session. What are the precautions and contraindications for dry needling? Of course, avoid dry needling in patients, first thing, who have phobia of needles, big no-no. Extra precautions close to lungs, liver, spleen, kidneys. Extra caution for central nervous system when you are close to C0, C1, and C1, C2, where you definitely do not want to dry needle in the midline with an angulation lateral to midline at a superior or a capillate direction. Pregnancy is a relative contraindication. Post-surgical lymphedema, contraindication to site distal to the removal of lymph node, and recent seizures. Some of the safe dry needling guidelines definitely always get a signed informed consent, making sure skin is clean, disinfection of skin prior to dry needling, which can be done by using 70% isopropanol or 0.5% fluorhexidine wipes, proper hand washing between patients, use of gloves, new needle to every new target, do not resheath the needle due to risk of cross-contamination. Furthermore, proper disposal of needles in sharp containers, disposal of soil clinical waste in hazardous waste bag, use of stainless steel needles to decrease risk of metal allergy, avoid electrical stimulation in patients with pacemaker or defibrillator, caution with patients taking warfarin or other anticoagulant therapy, instruct patients to avoid moving when the needles are inserted or in situ. Avoid needling in skin with poor circulation, wounds, moles, etc., and avoid dry needling in a recent or post-operation procedure up to 90 days, unless if the surgeon gives okay to dry needle. Some of the adverse effects, feeling of tired, drowsiness due to transient change in blood pressure, fainting, sweating, sense of weakness, palpitation, nausea, and vomiting. That could be due to autonomic nervous response, nervous system response. The patient can have a needle shock, which can cause fainting and anxiety of dry needling, possible vasovagal response, decrease in blood sugar, especially important in diabetic patients. I always educate them, make sure you eat something 1 or 2 hours prior to the scheduled treatment. There can be minor bleeding or bruising and temporary pain due to the needle insertion, and which can last up to probably the same day, or it could be next day, or maybe next day sometime. So that's about it. These are some of the references. And any questions if anybody has?
Well, thank you for that very informative presentation. I had a number of questions, but you answered most of them. So I guess the only thing I will ask is, does a patient have to be referred to receive this treatment, or can they just walk in?
Definitely there has to be a referral. We'll do a physical therapy evaluation, and then we'll go from there.
If you like, I can search the web for, hey Siri, most of them. So
Sorry, my Siri thought I was talking.
it's okay.
Does anyone else have any other questions? Okay. Someone in the chat has a question. Can someone work out after getting this procedure done?
I would definitely say, just wait out and see, because you don't want to have a feeling like if you're getting sore, you don't want to mix things. So definitely, I would say just wait it out and see how things play out. Yeah.
I had a quick question. I think I missed the beginning portion of this presentation, but what's the difference between dry needling and acupuncture then?
Sure. Let me take you to the slide itself. So basically, acupuncture is based on more like traditional Chinese medicine, and dry needling is more Western, based on more Western evidence-based practice. In acupuncture, they go by the chi lines or the meridians, where they say like, okay, there's like blockage in those lines, which can cause different issues.
Okay.
And dry needling is more musculoskeletal, like trigger points, or in general chronic pain and things like that.
Okay, cool. Thank you.
Sure.
Does anyone else have any questions? Feel free to leave them in the chat or just unmute yourself and ask directly. All right, well, if there are no other questions, everybody have a safe and happy Thanksgiving. And as usual, please be sure to follow us on our social media platforms. Thank you, Dr. Neeraj, for giving us that informative presentation. And it will be available shortly on our website and YouTube.
All right. Thank you. Thank you so much, guys, for giving me the opportunity. Thank you, Siraj, for being an excellent moderator. And everybody, thank you for your support for our Insight Comprehensive Outpatient Therapy Department. Thank you. Have a happy holidays.
Take care.
Thank you.